Welcome to the Fine Lecture Series. On behalf of the Perinatology Research Branch of NICHD and the National Institutes of Health, my name is Lami Yo, and I am one of the developers of Fine. In the next 4 videos, you are going to learn about the unique technology known as Virtual Intelligent Sonographer Assistance, or VISA Assistance, which we also call VISA. This is actually one of the most important and essential tools of the Fine method. Therefore, it is definitely worthwhile taking some time to learn about this technology. VISA Assistance, or VISA, are video clips for each of the 9 cardiac views, which function as a virtual sonographer to intelligently assist you in examining the fetal heart. So be sure to take advantage of this feature when performing the Fine method. This is part 1 of 4 videos on VISA Assistance, where we introduce this technology. Here, you will learn what is VISA Assistance and the background behind its development, the objectives of VISA, and finally, what are its advantages compared to conventional two-dimensional sonography or manual navigation of stick volumes. STIC stands for Spatiotemporal Image Correlation and is reviewed in detail in other videos of this YouTube series. Before we begin, please note that all of our scientific publications on the Fine method are freely available. You can access them by going to the main page of our YouTube channel, then click on this website link to the Perinatology Research Branch of NICHD and the National Institutes of Health. Links to all our publications on the Fine method can be found. Also, we encourage you to subscribe to our YouTube channel to learn more about Fine, its features, and practical implementation in the clinical setting. More educational presentations will be forthcoming. Now, before we discuss VISA Assistance, let's briefly review the Fine method. This is a novel sonographic method to examine the fetal heart. Fine automatically generates and displays 9 standard fetal cardiac views simultaneously by applying intelligent navigation technology to stick volumes of the fetal heart. Fine simplifies the fetal cardiac examination, shortens examination time, thus improving clinical efficiency and workflow, and reduces operator dependency. After a stick volume has been acquired and then determined to be appropriate using stick loop, the next step is to mark 7 anatomical structures of the fetal heart within the stick volume using the anatomic box tool. And once marking is completed, this triggers intelligent navigation technology. By identification and selection of key anatomical landmarks, the system will generate a geometrical reconstruction or model of the organ of interest, such as the fetal heart, and then automatically navigate, find, extract, and display specific planes, in this case, 9 standard fetal echocardiography views for the Fine method. We refer to the 9 fetal echocardiography views automatically generated and displayed by Fine as diagnostic planes, and they are the 4-chamber view, 5-chamber view, left ventricular outflow tract, short axis view of the great vessels, right ventricular outflow tract, 3 vessels and trachea view, abdomen, stomach, ductal arch, aortic arch, and the superior and inferior vena cava. Here are the 9 diagnostic planes in motion, displayed together in a single template for a normal fetal heart. Note that FIND also provides automatic labeling of each cardiac view, left and right sides of the fetus, cranial and caudal ends, and fetal anatomy. How is Visa Assistance activated? After the 9 diagnostic planes are shown by FIND, choose and click on any diagnostic plane of interest. In this example, it is the 3 vessels and trachea view plane that is clicked, as shown by the orange box. Next, a button on the left side labeled Visa Assistance should be clicked. Next, the Visa Assistance video clip for the cardiac view is activated. On the left side is the original diagnostic plane of the 3 vessels and trachea view, while on the right side the Visa video clip plays and there is automatic sonographic navigation and exploration of surrounding structures. As a result, the Visa image has changed to become the 3 vessel view, which is different from the original diagnostic plane, which is the 3 vessels and trachea view. Now let's review the background of Visa and provide a brief introduction as to what this tool does. Performing real-time 2-dimensional sonography of the fetal heart is a challenging and highly operator-dependent modality. The sonologist is responsible for obtaining informative, standard fetal cardiac views from a 3-dimensional heart, such as the views shown here. Yet the fetal heart is a complex organ and therefore should be studied in more detail on ultrasound to determine if the fetal heart is normal or abnormal. For example, pulmonary venous anatomy, shown by the white arrows, should be evaluated when performing fetal echocardiography. The objective is to rule out the cardiac condition known as total anomalous pulmonary venous return, in which the pulmonary veins do not connect to the left atrium as usual. The image on the left is the normal 4-chamber view, but the pulmonary veins are not well seen in this plane. By slightly moving the transducer, the pulmonary veins can now be seen entering the left atrium, as shown by the video clip on the right. Similarly, both the 3-vessel view and 3 vessels and trachea view are important to obtain on ultrasound, since they provide useful diagnostic information about the fetal heart. The 3-vessel view shows the ascending aorta, indicated by the red arrow, while the 3 vessels and trachea view is characterized by the transverse aortic arch, as shown by the white arrow. By tilting the transducer in real-time sonography, both cardiac views can be obtained. The aortic arch and ductus arteriosus should also be assessed routinely, yet they are quite close together, as seen in the video clip. And distinguishing one from the other requires operator skill as well as subtle movements of the transducer. This can be a challenging task to achieve. Another issue is that when examining the fetal heart sonographically, the examiner must recognize that in normal fetal hearts there is anatomic variation. For example, the same cardiac view, such as the 4-chamber view, appears different among various normal fetuses. All of these images were taken from normal fetal hearts, yet the same cardiac view looks different from one fetus to another. This is evident in the ductal arch view, 3-vessel view, and the 4-chamber view. When there is congenital heart disease, examining the fetal heart on ultrasound is even more arduous, since the heart needs to be studied comprehensively and in great detail to determine the diagnosis as well as the prognosis of the condition. For example, the fetus on the left has coarctation of the aorta. The short axis view of the great vessels shows that the circular aorta is smaller than the pulmonary artery. The right video shows a different fetus affected with transposition of the great vessels. Notice that the great vessels are parallel as they arise from their respective ventricles. For both of these cardiac defects, it is very important to diagnose them in the prenatal period, since scientific studies have shown that this may improve the outcome of such fetuses. Now, let's go back to FINE. This method was developed to automatically generate and display 9 fetal cardiac views simultaneously for the purpose of identifying whether fetal hearts are normal or abnormal. Yet after taking all of the information just presented into account, we recognize that our next and important challenge was to figure out a way to study the complex fetal heart in more detail and further improve the quality of the examination. Our challenge was to achieve this in an automatic and intelligent manner. In other words, developing a virtual sonographer would be valuable. What do we mean by this? A virtual sonographer would function similarly to an actual sonographer scanning the fetal heart during real-time sonography. So, the goal was to develop a tool that would automatically examine the fetal heart and do so in an intelligent, simple, and rapid manner so that operator dependency would be reduced. The tool created to meet these needs is known as VISA Assistance, which stands for Virtual Intelligent Sonographer Assistance. VISA Assistance is an operator-independent tool that allows automatic sonographic navigation and exploration of surrounding structures in each of the 9 cardiac diagnostic planes. It is essentially a virtual sonographer in the form of video clips for each of the 9 cardiac views. As you will learn from other VISA videos in this YouTube series, the automatic navigational movements through the stick volume are never random. All movements have been programmed to be purposeful, targeted, and intelligent, with the goal of visualizing specific anatomic structures and yielding additional information. To review again, here is an example of VISA for the 3 vessels and trachea view. The original diagnostic plane successfully obtained by FINE is shown in the left image. However, as the VISA video clip plays on the right side, please notice that the image begins to change automatically into the 3-vessel view through navigational movements of FINE and not by the operator. This artistic representation demonstrates the VISA movements just shown, in which the 3 vessels and trachea view is automatically being changed into the 3-vessel view. Now, we just stated that the automatic navigational movements through the stick volume, which are performed by VISA, are intelligent. So how is VISA Assistance intelligent? What do we mean by this? VISA consists of invisible pivot points that automatically change. The sequential movements seen in the VISA video clip are centered around such pivot points. Moreover, VISA allows a combination of rotations, such as the X and Y rotations simultaneously, around the pivot points, and this is unique to the FINE method. So far, we have reviewed VISA Assistance technology, But what are the main objectives of VISA? As you will learn from other VISA videos of this YouTube series, it improves the success of obtaining the fetal echocardiography view of interest when not initially obtained via the diagnostic plane. VISA provides more information about the diagnostic plane and its surrounding structures, such as the pulmonary veins. And it improves the quality of examination, since the complexity of the fetal heart can be studied in greater detail and specific structures shown. Finally, before we review the distinct advantages of VISA assistance compared to traditional real-time two-dimensional sonography or manual navigation of stick volumes, let's review manual navigation briefly. When we perform real-time two-dimensional sonography, we are actually doing manual navigation. The operator must find their way through the fetal anatomy to obtain informative cardiac images, all of which is highly operator dependent. Manual navigation is also defined as interaction of the operator with a stick volume dataset. In other words, operating the X, Y, and Z controls, scaling, and parallel shifting. In this example of manual navigation through a stick volume, the sonologist is trying to obtain fetal cardiac views using software provided by the ultrasound manufacturer. The user is performing X, Y, and Z rotations on the multiplanar display. As shown here, this process is highly operator dependent and can be quite challenging. So our goal in developing FIND was to eliminate the multiplanar display and manual navigation of stick volumes. VISA assistance has 4 distinct advantages compared to real-time two-dimensional sonography or manual navigation of stick volumes. First, VISA allows automatic navigation through the stick volume, and therefore operator dependency is decreased. In other words, there is no manual navigation of the fetal heart performed by the operator, as shown in the right video clip. Here, two-dimensional ultrasound of the 3-vessel view and 3 vessels and trachea view is being performed by the operator. Second, each time that VISA is activated, there are consistent navigational movements through the stick volume, as evidenced by the callouts written at the top of the video clip in the red circle. Callouts describe the specific action or purpose of the navigational movements, and these are always the same for every case. Callouts are described in detail in another VISA lecture of this YouTube series. In contrast, when performing two-dimensional sonography or manual navigation of a stick volume, each examination and series of steps may not be identical for the same examiner or between examiners. Please observe the VISA image of the short axis view of the great vessel's right ventricular outflow tract. Notice that the type of automatic navigational movements through the stick volume by VISA are unique and fluid and would be manually difficult or impossible to perform by a user. The precision and consistency of VISA movements may not be achievable through real-time two-dimensional sonography or manual navigation of a stick volume. And finally, the time duration of VISA is typically shorter, less than 4 minutes, as compared to the performance of real-time two-dimensional sonography or manual navigation of stick volumes. In conclusion, VISA assistance is an operator-independent tool that allows automatic sonographic navigation and exploration of surrounding structures in each of the 9 cardiac diagnostic planes. It is essentially a virtual sonographer in the form of video clips for each of the 9 cardiac views. The automatic navigational movements through the stick volume are never random. All movements have been programmed to be purposeful, targeted, and intelligent. The objectives of VISA are to improve the success of obtaining the fetal echocardiography view of interest when not initially obtained via the diagnostic plane, provides more information about the diagnostic plane and its surrounding structures, and improves the quality of examination since the complexity of the fetal heart can be studied in greater detail and specific structures shown. VISA Assistance has 4 advantages compared to real-time 2-dimensional sonography or manual navigation of stick volumes. It allows automatic navigation through the stick volume. Second, each time that VISA is activated, there are consistent navigational movements through the stick volume. Third, the types of navigational movements through the stick volume are unique, fluid, and would be difficult or impossible to perform otherwise. And last, the time duration of VISA is typically shorter, less than 4 minutes. Please be sure to watch the next video on VISA Assistance, which is part 2. Here, we will specifically review the 7 benefits of VISA and how you can use this to study the fetal heart in more detail and further improve the quality of ultrasound examinations for pregnant women. Thank you for your attention.